What is behavioral psychology? Behavioral psychology is basically a theory, and it's based off of hypothesis that the environment that we live in sometimes determines how our behavior is. Um, Within behavioral psychology, typically the individual gets studied on different behaviors that affects them and how they can overcome these type of effects. Sometimes the environment that we live in can definitely have an impact on how we behave. For example, poverty. Growing up in poverty can definitely impact someone. It can make them have pressure on them, making them feel like they have to get out of the poverty. It can make them angry, depressed. They can think about all the struggles that they had to encounter and things of that sort. That can also fall in line with triggers that typically trigger individuals when they're getting a diagnosis. Sometimes the behavior psychologists can study them and think of what triggers can affect them. And when a person is talking about poverty with another person and that really has affected them or impacted their lives, that can be a trigger. And what a behavior psychologist does, it just figures out how exactly can they stop that trigger or teach a person how to deal with it. Um, your everyday habits are all factors of what can be used to determine behaviors and the effects. So this can mean how you get out the bed every day, how you walk around, your attitude, what you do before you go to sleep, when you're at school, when you're around other peers, and things like that. The main focus of behavioral psychology is basically the study, analysis, and proper treatment. When a patient is having different behavior issues, there are a lot of things that come into place to help them. Behavior psychologists want to find the root of the problem, also known as the trigger, or also known as the why. Typically, when you figure out exactly why something is bothering a person, that can help you figure out how you can help them or how to help them cope with the situation or how to simply just remove them from it so that it will not, make them keep going through these same behavior issues that they are having. Um, Typically, when there is a study analysis and also proper treatment, there are ways to reinforce positive behaviors and extinguish negative ones. There is also an ABC method that most behavioral psychologists use in order to help a individual who has behavior issues. The A stands for antecedent. It's an environmental stimulus that creates a response. So that typically just means, the environment you're in, how are you responding to that? The behavior, the action or reaction that emerges from the person or as the result of a perceived antecedent. And C, consequence. This is a positive or negative response to the behavior that either reinforces or encourages future performance of that behavior or discourage the future behavior. So as we talked about as I talked about on the last slide, between positive and negative reinforcement, um, sometimes this goes into the behavioral theory and also learning behaviors. The behavior theory typically focus on how a person learn. So when a person is trying to learn, not everyone learns the same, and not everyone can stop negative behaviors the same. So, an example of positive reinforcement is giving a child a sticker for passing the math test. Typically, especially little kids, when they do good in school or they pass a spelling bee test or, like a math test, you give them a sticker. Sometimes they can teach them, okay, this is a good thing. I should keep doing this. It'll put an ambition in them to make them keep doing it and say, okay, how can I keep doing this? It'll make them study more, things like that. Negative reinforcement would be putting a child in timeout for hitting someone. Negative behaviors like that, I feel as if, putting a child in timeout can teach them, okay, that's not something that you're supposed to do. You're not supposed to just go out and hit someone for no reason. I feel as if that's a good way of negative reinforcement simply because putting a child in timeout can give them time to think and things like that and help them figure out, okay, this is not something that I should be doing. Why did I do this? Next time for the future, How can I go about a different approach when something is bothering me other than hitting someone? Applied applied behavior analysis. There are different behavior disorders when trying to learn certain things. As I stated before, not everyone learns the same way. Some people learn stuff by, getting those positive reinforcements or those negative reinforcements. It just depends on the way that a person can learn. Um, there are definitely different learning patterns that come into place when a person is trying to learn. Also, those learning patterns and the environment that you are in sometimes can clash and go hand in hand, because you have a certain learning pattern that you're trying to focus on, but the environment that you're in is not really helping you focus on how to learn. So this applied behavior analysis is just getting a person to focus on how they can learn and what type of pattern that they can stick to. Applied behavior analysis is really for most patients who have autism. Typically, an individual who has autism, they just need a pattern that they can stick to so that they can learn certain things and certain stipulations when it comes to being successful in life. So to be a behavior psychologist, you have to have your bachelor. You can have your bachelor's degree in any field, preferably in psychology or social work. You do have to have your master's in psychology or counseling. The salary right now in North Carolina is $62,397.50. The typical base salary is $72,778. You also do have to get a license, and you have to pass the examination for professional practice. To piggyback off of this salary, typically when you climb up the ranks, that's the more money that you make. So um, they did state in research, having your license in different states can, climb you up the ranks a little bit, because it's basically like you have experience. Definitely staying in the field for a long time can also help you climb up the ranks and also get you that salary that you are looking for. Typically, you can earn up to $90,000 a year with being a behavior psychologist. The main role of a behavior psychologist is to basically help individuals who have mental disorders. This can consist of depression, alcoholism, schizophrenia, autism, things of that sort. It's basically just, helping a person who's dealing with something figure out a way of how to deal with it, or a way to, move past that and, get a learning pattern that can help them keep moving forward. As I stated in all the previous slides, sometimes a learning pattern is not easy, and it also depends on your behavior, your environment. All of those things go into place when you're trying to learn different things and when you're behaving in different ways. So when you're trying to basically help an individual being a behavior psychologist, you offer different assessments, evaluations, you record their observations, you keep detailed notes and records, and you work with interdisciplinary teams. And that can mean, like, a parent, a peer that you're close to, cousins, things like that, because at the end of the day, when you're around certain people, they typically know why you act the way that you do, or what can help you, or what patterns that they see that can help you learn more. There are different career paths in being a behavioral psychologist. There's a substance abuse, behavioral disorders, social worker, marriage and family therapist, and also a school counselor. And these are my references.